Plants need water and sunlight to make fuel. Machinery guzzles oil or electricity for energy. And us? People convert food into a sugar called glucose. Glucose is then released into the bloodstream so hormones called insulin can transport it into our body's cells for use. Sounds simple, until you don't have any insulin or insulin isn't working properly. Then you have a disease called diabetes. When glucose can't get into the cells, it stays in the bloodstream, accumulating over time. We call that hyperglycemia.
High blood sugar is the major focus of diabetes. It's eating too much and your body not being able to digest it. So that you take the food in, it's got a high sugar content, whether it's fat or carbohydrates or whatever. Your intestines break it down, it gets absorbed into the bloodstream, but there's not enough insulin to get rid of it, to take care of it. And that will cause that blood sugar to go up unless it's treated appropriately.
Hyperglycemia can happen to diabetics if they eat more or exercised less than planned. Stress, infection, and illness can affect the body's processing of insulin so that even if you plan it perfectly, you can still miss your target blood sugar levels. Frequent, untreated hyperglycemia can cause serious complications.
Hyperglycemia is a problem because the higher the blood sugars are, the more chance there is of having the consequences of diabetes. That's where the real problems of diabetes arise. The secondary consequences, typically vascular problems where you can get strokes and heart attacks and things like that. Neuropathy, neurologic problems where you wind up with numbness in the legs, pain in the legs, and all, which can be a very dangerous thing. Kidney problems, that's probably the most important factor. The higher the blood sugars over a longer period of time, the more likely you are to damage your kidneys. So you want to really keep that down. And the fourth thing are the eyes, the retinopathy that can develop, again, because the blood sugars are too high.
It can take 15, 20, or even 25 years of having high blood sugar levels to cause those severe complications. Unfortunately, for those who have type 2 diabetes for a long time, they may not exhibit any symptoms at all.
There may be none. That's the problem, is that a high blood sugar may not have any symptoms at all. The only symptoms, if it gets high enough, is that you'll feel very thirsty and dry and want to drink plenty of fluids, or you wind up urinating more than you would normally expect to. But most of the time, if you've been a diabetic for a while, you may have no symptoms at all. And the only way you can tell, and that's why we ask patients we ask all of our diabetic patients now that it's available to get a meter, or we'll give them a meter and tell them to check their blood sugars.
It's important to treat hyperglycemia when it's detected. If your blood sugar is too high for 2 to 3 readings in a row, you should call your doctor immediately. Now, drinking water will help remove excess sugar through the urine, and exercise can lower blood glucose levels, but you should test your urine for ketones first if the blood glucose is above 240. Exercising with ketones present can have the opposite effect and make the glucose levels go even higher. Once this instance of hyperglycemia is treated, you and your doctor may have to reevaluate your current diabetes management.
It's the kind of thing where, is it just a one-time kind of thing, or is it happening frequently? And if you see it, then really you have to call, because your physician is the person that's treating you, that's giving you the medications that you need for it. And if your sugars are running high, then you may have to adjust that. Or if you've got a meter, you're going to see your blood sugars are 300 and 400 or something like that. And then either call your physician immediately, or if you can't get a hold of him, then yes, you should go to an emergency room under those circumstances.
It's estimated that about 1/3 of diabetics don't know they have it. People may be living with chronic high blood sugar levels, putting themselves at risk for complications of diabetes down the line. Being diagnosed can be the first step toward reducing those blood sugar levels that are elevated and living a long and healthy life. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.